Spread of cardiac impulse. Conducting system of the heart. The structures that make up the conduction system are sinoatrial node, SA node, intermodal tracts, atrioventricular node, AV node, bundle of His, right and left bundle branches. Since SA node has the highest rate of discharge, it is the normal pacemaker of the heart. SA node is located at the junction of the superior vena cava and the right atrium. Impulses generated in the SA node pass through the anterior, sometimes also called Bachmann's bundle, middle, tract of Wenckebach, and posterior, tract of Thorel, tracts to the AV node. AV node is located in the right posterior portion of the interatrial septum, near the ostium of the coronary sinus. Intrinsic rate of discharge. AV nodal fibers 40 to 60 times per minute. Purkinje fibers 15 to 40 per minute. Purkinje fibers are specialized conducting cells. These are modified contractile cells run subendocardially and are largest diameter and fastest conducting fibers in the heart. Rate of conduction 1.5 to 4 meters per second. Large number of gap junctions in the intercalated discs help achieve this high velocity of conduction. SA node develops from structures on the right side of the embryo, therefore the right vagus is distributed to the SA node. AV node, on the other hand, develops from the left side. It is under the control of the left vagus. We do need to remember, however, that there is a considerable degree of overlap. Transmission of cardiac impulse through the different parts of the heart, showing the time of appearance in fractions of a second after the initial appearance at the SA node in different parts of the heart. The impulse starts at the SA node, spreads to the atria, and also travels through the intermodal tracts to reach the AV node, taking 0.03 seconds to do so. AV nodal delay 0.9 to 0.1 second. Note the total delay at the AV node and AV bundle system of 0.13 seconds, so that the impulse reaches the two bundle branches at 0.16 second from start. Cause of nodal delay: diminished number of gap junctions between successive cells. Advantage of nodal delay: this allows the atria to contract ahead of the ventricles, resulting in the last part of filling of the ventricles. The impulse now spreads via the bundle branches and finally the Purkinje fibers to all parts of the ventricle. The endocardium depolarizes first, followed by the epicardial surface. Ventricular depolarization and repolarization. First part of the ventricle to be depolarized is the left upper part of the interventricular septum. Septal depolarization is left to right. The wave of depolarization then spreads down the septum to the apex of the heart, proceeding from endocardial surface to the epicardial surface. The last part of the ventricle to be depolarized is the posterobasal epicardial region of the left ventricle, the pulmonary conus, and a small uppermost portion of interventricular septum near the base of the heart. The direction of repolarization is reversed. Repolarization proceeds from epicardium to endocardium. The first part of the ventricle to be repolarized is apex, epicardium, and last to repolarized is base, endocardium.